How do you prevent the big C, cervical cancer in women? 3 important steps. Number 1, undergoing cervical cancer screening. Number 2, administration of cervical cancer vaccine at the right age. And number 3 is safe sexual practices. What is cervical cancer screening? This means finding out changes in the cervical cells even before they become a cancer. So we do pap smear, which is essentially looking at the cervical cells for these changes, and we do a test for human papillomavirus, which is the HPV test. Why is it important to screen for cervical cancer? By screening, you are able to pick up the changes in the cervical cells even before they become cancerous. Human papillomavirus, the HPV virus, can lead to either a mild infection or a severe infection. Now, usually a mild infection of HPV can lead to low-grade changes in your cervical cells. Normally, the immunity of our body helps clear off this low-grade infection. When a woman is detected to have low-grade cervical changes, normally this woman is called back in more frequently to have checks on this to make sure that this has been cleared by the body's immunity. But what happens if you have an infection by a high-risk virus? Or what if you have a persistent HPV infection which has led to a high-grade change? We know that high-grade changes, especially high-grade persistent changes in your cervical cells, could lead to cervical cancer if they persist for more than 1 to 2 years. It takes about 3 to 7 years for a high-grade change to become a cervical cancer. It is very important that you seek treatment for your high-grade changes if that is detected. How does one get exposed to HPV virus? It is important to understand that HPV virus spreads through skin-to-skin contact. Sexual intercourse is one way of getting HPV virus, but it is not the only way in getting exposed to HPV virus. Just a skin-to-skin exposure with somebody who is infected with HPV virus could also lead to infections. Now, normally the body's immunity is able to clear off most of the infection and only some of it persists. The HPV infection can also spread from one part of the body to the another. Like for example, if the cervix is infected, the infection can then move on to the vagina and the vulva and infecting these areas as well. One of the simple ways in limiting your exposure to HPV virus is reducing the number of sexual partners or simply avoiding having sexual encounters with somebody who has multiple sexual partners or is showing any symptoms of any sexually transmitted diseases or genital warts. Cervical cancer vaccines are a very essential part of preventing cervical cancer. It is very important that all children between 9 to 12 years of age receive a cervical cancer vaccine. If the young adult is between 13 years to 26 years of age and has not been vaccinated previously, they should be offered this vaccine as soon as possible. Beyond the age of 26, cervical cancer vaccines are not recommended, and this is simply because their efficacy is less in this age group. It is very important to remember that cervical cancer vaccines work best before the exposure of HPV virus. One of the ways of HPV virus exposure is through sexual intercourse, and the whole idea of giving it earlier on in the age in young children is we need to give this vaccine before they're exposed to HPV virus for it to work the best and provide almost complete protection.